Hi everyone, welcome back to my YouTube channel, and today we are going to talk about odontogenic cysts. So let's start our topic with introduction. Odontogenic cysts are pathological cavities in jaws that are lined by epithelium and arise from tissue involved in tooth development. They are among the most common jaw lesions and can cause bone expansion, tooth displacement, or infection if untreated. These cysts are classified as inflammatory or developmental depending on their origin. Definition of odontogenic cyst. An odontogenic cyst is defined as a pathological epithelial lined cavity that is located in the jaw, originating from tissue involved in tooth formation and containing fluid, semi-solid, or gaseous material, and it is often associated with a tooth or its developmental remnants. Etiology of odontogenic cyst. Odontogenic cysts develop from remnants of dental epithelium or chronic inflammation that is associated with non-vital teeth. The major causes include inflammatory causes, as they are secondary to pulpal necrosis and or chronic periapical infection. Examples include radicular cyst or periapical cyst. Then there are developmental causes that result from remnants of odontogenic epithelium without infection. Examples include dentigerous cyst that is associated with crown and unerupted tooth, odontogenic keratocyst that arise from dental lamina remnants, and lateral periodontal cyst that is found along the lateral aspect of tooth roots. And traumatic or iatrogenic factors are there, like rarely trauma or surgical intervention may stimulate epithelial remnants. Pathophysiology of odontogenic cyst. Odontogenic epithelium undergoes cystic degeneration, thus forming a fluid-filled cavity. Then inflammatory mediators stimulate epithelial proliferation in cysts of inflammatory origin. And then there is slow growth that causes bone expansion, tooth displacement, and cortical thinning. In some cases, cysts may become secondarily infected, leading to abscess formation. Classification of odontogenic cysts. Odontogenic cysts are broadly classified into inflammatory cysts that include radicular cyst, that is most common, residual cyst, that is because of remains after extraction of causative tooth, and then there are developmental cysts that include dentigerous cyst that is associated with the crown of unerupted tooth, and odontogenic keratocysts that arise from dental lamina remnants, and it is aggressive cyst. Then there is lateral periodontal cyst that is found lateral to tooth roots, and usually it is in the adults. And gingival cyst that has soft tissue variant of the odontogenic cyst, and calcifying odontogenic cyst that contain ghost cell, and it is rare in occurrence. Clinical features of odontogenic cyst. They are mostly asymptomatic initially, but they are slow growing cysts and they may cause swelling of jaw or gingiva, tooth displacement or mobility, facial asymmetry in large lesion, and pain occur if secondary infection or abscess formation occurs. Radiographic features of odontogenic cyst. It has well-defined radiolucency with corticated margins. The location and shape depend on the cyst type. Like radicular cyst is mostly associated with apex of non-vital tooth. Dentigerous cyst is around the crown of an unerupted tooth. Odontogenic keratocyst is unilocular or multilocular and may extend along the jaw. Radiographs help in diagnosis, treatment planning, and monitoring of odontogenic cyst. Histological features of odontogenic cyst. First, there is cyst lining that is made of stratified squamous epithelium that is sometimes keratinized, like in case of odontogenic keratocyst. There is fibrous connective tissue wall that contain chronic inflammatory cells, and ghost cells is also present in calcifying odontogenic cyst. Inflammatory cysts often show infiltration of lymphocytes, plasma cells, and macrophages. Differential diagnosis of odontogenic cyst. First is periapical granuloma, that is non-epithelialized lesion. Second differential diagnosis is odontogenic tumor, that are larger and more aggressive lesion than odontogenic cyst. Third is bone cyst of non-odontogenic origin, like traumatic bone cyst and aneurysmal bone cyst. Management of odontogenic cyst. First, it is managed by elimination of cause, like for an inflammatory cyst, through root canal therapy or extraction. Second, we can do a surgical removal, that is also called as enucleation, for larger cysts or developmental cysts. Third, we can do is marsupialization, that is for very large cysts, and it helps to reduce size of the cyst before enucleation. Fourth, we can do is regular follow-up with the radiograph to monitor healing and recurrence. Prognosis of odontogenic cyst. Prognosis is excellent for small, properly treated cysts. Odontogenic keratocysts may recur and require careful monitoring. And untreated cysts may cause bone destruction, tooth displacement, fractures, or infections. Clinical significance of odontogenic cysts. Odontogenic cysts are common jaw lesions that are often asymptomatic but capable of causing serious complications if neglected. Early diagnosis and management preserve jaw structure, teeth, and function. Differentiation between cyst type guides appropriate treatment and prognosis. Conclusion of this lecture video. Odontogenic cysts are epithelial line lesions that arise from odontogenic tissue that is classified as inflammatory or developmental. They may remain asymptomatic but can lead to bone expansion, tooth displacement, and infection. Management involves root canal therapy, surgical enucleation, or marsupialization depending on the cyst type and size, with generally excellent prognosis if treated timely. And this was all about odontogenic cyst. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.